Alright, let's talk about the new over-the-counter birth control. It's called Opill, and it's the first oral daily contraceptive available without a prescription. It's a progestin-only pill, which is what we usually recommend to patients who have a contraindication to estrogens. So patients who have a history of a blood clot, migraine with aura, heavy smoking, uncontrolled hypertension, or high blood pressure. Norgestrel is a second-generation progestin, and it has weak androgenic activity. So it binds to androgen receptors, which is the same thing that androgens bind to, like testosterone and DHT. It's a mixture of dextronorgestrel and levonorgestrel, which is the active isomer. Levonorgestrel is in Plan B at a much higher dose. Also mentioned, norgestrel is not really a new drug. It's in Crycel, which is norgestrel and ethinyl estradiol. It's a combined hormonal contraceptive by prescription. Opill suppresses ovulation in about half of its users and then also thickens cervical mucus, which decreases sperm penetration and motility to the egg. Efficacy with perfect usage is about 98%, which is comparable to other oral contraceptive options. This means that 2 in 100 female patients will get pregnant with 1 year of usage. Important to note that up to 10% of pregnancies in progestin-only pill users are extrauterine, meaning an ectopic pregnancy. This is a medical emergency. This is when the egg implants outside of the uterus, usually in the fallopian tube, which connects the ovaries to the uterus. Signs to watch out for are lower ab or pelvic pain that can be unilateral or on one side, and then also abnormal vaginal bleeding. One of the most important counseling points with Opill is that the missed dose window is 3 hours. You have to take it at the same time every single day. This has to do with rapid distribution and elimination of norgestrel, and then a lower steady-state concentration of progestin levels and shorter elimination half-life versus combined hormonal contraceptives. If you're more than 3 hours late on your dose, take it as soon as you remember, and then resume the normal time that you take it. This means that you could take up to 2 tablets in 1 day. You also have to use a condom or another barrier method for 48 hours after you restart the medication. Also mention that you need a backup contraceptive for 48 hours if you also throw up the dose within 4 hours after taking it. And then also for 48 hours after you first start the medication. The most common side effects are vaginal bleeding, spotting, and breakthrough bleeding. Side effects that have an incidence of greater than or equal to 5% include nausea, breast tenderness and discomfort, headaches, abdominal pain, cramping, and bloating, nausea, dizziness, fatigue, vaginal discharge, nervousness, dysmenorrhea, which is pain with menstruation, and backache. You also see acne and then increase in appetite or weight gain, which likely has to do with its androgenic effects. Contraindications with this medication include history or active breast cancer or any progestin-sensitive cancer, undiagnosed abnormal genital bleeding, liver tumors or liver disease, and then also pregnancy, although it won't harm the baby. Breastfeeding on progestin-only pills are not shown to harm the baby either, but it does pass through the breast milk, so always talk to your OB-GYN. So drug interactions. It is a major CYP3A4 substrate, which is the major CYP enzyme that metabolizes most drugs. So we can see a decrease in concentrations and an increase for contraceptive failure with patients who are also on carbamazepine, phenytoin, phenobarbital, primidone, rifampin, and St. John's wort. Also mentioned that oxcarbazepine is a weak 3A4 inducer, and then also probably at higher doses to pyramate we can see an interaction here.